Let's continue with our conversation on the NHIF, and Engineer Michael Kamau is still here with us, the chairperson of NHIF. Engineer, thank you for being patient with us.
Thank you.
So, before we went for that conversation, you had mentioned issues to do with the deductions, and you're saying this is about leveling the playing field.
Yes.
So I did some mathematics while you were away, and it doesn't make sense. So if somebody who's earning 30,000,
yes,
if you're the one who gave the example, is deducted 2.7%, that is 825. If a person who's earning 500,000 is deducted the same amount, it is 13,750. Let's start with the person who's earning 30,000, okay? The deductions now come to 825. But someone who's unemployed is supposed to pay 1,000 shillings. So how is it that someone who's employed and earning 30,000 at a deduction of 2.75% pays 825, and someone who's completely unemployed pays 1,000 shillings? Where's the fairness in that?
Now let's start. You said somebody who is unemployed?
Yes.
First of all, there are two categories of unemployed people. Those without jobs and those who won't be able to pay, even if you whip them. The indigents. Even now, we have 1 million indigents for whom the government is paying at a rate of 500 bob, identified from counties. County governments actually identify them, and the government pays for them. The rest of the people who are in the informal sector were paying a flat rate of 500 bob. Let me now explain this. It gets very interesting. Take 500 bob. You are a guy from Gikomba, from Kamukuji, from anywhere who has an income here today and tomorrow. Okay? 500 bob. Let's suppose for the sake of arithmetic, because you are not employed, it is not a payroll check-off system. So we don't care. Take your house help. I don't know how much you pay them, but let's assume most people pay about, say, 10,000. That person is paying 10,000, multiply 500. Multiply that for 10 people, that's 100,000. So 10 house helps earning 100,000, okay, would cumulatively pay 5,000 bob. Do you get it? The income of 10 house helps put together would pay 5,000 bob. Let's say you have an employer in Nairobi earning even 500,000. You are paying 1,700. You have 5 workers, you have a gardener. Let's, for the sake of it, assume you're in Karen, you have a gardener, you have a driver, you have people. 5 of them are paying 5,000. You, the boss, earning 500,000 is paying 1,700. Tell me, why is the fairness?
But the computation doesn't work like that, because you see, everybody has to be deducted based on what they can afford. And I'm telling you here that this one, for the unemployed people, if they're paying 1,000 shillings, yes, where's the fairness in that? Somebody who's earning 30,000
I don't get your arithmetic.
Okay.
The 1,000 is coming from where?
So there's a proposal that people who have been paying 500 shillings need to pay 1,000. Is that true? They're unemployed.
No. The minimum payment for anybody who cannot afford is 300 bob, down from 500. All the people in the informal sector, before we can assess their levels of income, are going to pay 300 bob, a drop of 40%.
Okay. 40%
drop. So actually, it is a drop of the income to NHIF. For example, the house help that we are talking about, who was paying 500, from 1st of June, July, at the end of it, pays 300 bob.
Okay.
Once this thing goes, it's been accented to 500 bob.
Okay.
300 bob.
All right.
Which is a drop of 40%.
Okay. Yeah. But there's a general feeling. Let's talk about now the upper band, the 500,000 that you gave as an example.
Yes.
This person then pays 13,750.
Yes.
What will be the value of money for this person? Are they going to be treated differently from the person who's paying 300 shillings?
No, first of all, the whole basis of insurance, let me tell you, we are one people, one nation, one Kenya. The person who is earning, is one body, if I may go to the Bible. Some of us are eyes. Some of us, we think we cannot do with them. They are nails, you can cut them off and nothing happens. Some of us are fingers. All of us, those who can pay more to support those who can pay less.
But you're the one deciding that they can pay more.
Let me tell you, this is the whole essence of social insurance. Those who are not sick, for example, take a guy who is 21 years old. That guy, the chances of falling sick, in fact, I always say, we used to pride ourselves, like from the age of 18, you have never seen a doctor, and you are not likely to see a doctor. But now, get to where I am, okay? A cough here, a cough there. Every 3 months, you are seeing a doctor. Somebody in their 70s already have some chronic disease, hypertension. The young pay for the old. Those who can pay more, pay for those who can pay less. It won't matter if we only have the rich people being able to pay insurances in Bupa, or the private insurances, and their health is taken care of. They can go to India, they can go everywhere, and then the rest of us are sick. We are all going to die.
But NHIF is not a tax, engineer. NHIF is a contribution for a service.
Yes.
This is why people are saying that the people who are earning more feel like you're punishing them. Because if they are going to pay 13,750, and we're using the base figure of 500,000 like you raised, up from 1,700, where is the value for money for them? Are they going to get better treatment? Are they going to get better services because now they're paying more?
We have the super cover, which has 10 benefits. Those are the benefits that are going to accrue to everybody. The social health insurance bill, work on the social health insurance bill has started, which will compel everybody now to join NHIF. At the moment, it's voluntary, unless you are in the informal sector. If you are in the informal sector, you are not forced to contribute. Okay? But woe unto you when you bought that motorbike and you have an accident. Okay? And today the president was just talking about the 23,000 direct deaths caused by motor accidents, and about the 28,000 people who are involved in accidents in Kenya, are injured or something. What happens? We take insurance as a cover for what is unforeseen. Okay? Take, for example, myself. I have private insurance. I have not used it for 5 years. My premiums go, but they don't increase my premiums because I'm not claiming. So the whole essence of insurance is pooling resources. At one time, even though you are in your 30s and paying, you are going to retire, you may not be able to even pay for insurance at the age of 70 or 80, and that is where the government kicks in.
Engineer, I'm looking at this National Health Insurance Fund Regulations 2023, Cap 13. A contributor who is not employed or listed as an indigent person or vulnerable person shall pay a monthly contribution of 1,000 shillings.
Oh, that is what you are referring to. Oh no, that is in the public domain. It is, we are undergoing public participation. But we have said it is 300 bob. I think that got in there wrongly. And it's been picked off during our public participation. We've just concluded our public participation, and that is one of the issues.
So you're saying this Cap 13...
Yes, it's not regulations.
...will be...
you should have participated. Now, this is part of the public participation. I'm here doing public participation. That is one of the things that has been contested. It's 300 bob.
Therefore, it has been reduced to 300. You
yes,
clarified
it's 300 bob.
That on the
300
act, it will be 300 and not 1,000.
Minimum contribution even for indigents and people who are without employment. But we are going to assess your level of income for the informal sector. Because once we get into the social health insurance, we've already identified about 100,000 community health promoters. Each of them will be 100,000 countrywide, identified by the 47 county governments. They are going to be kitted, and each of them will be taking care of about 100 households. These are the people who are going to identify the people who actually have income, those who cannot be able to pay, and therefore we have a system of identifying those who can be treated as indigents.
I'm getting questions here that will the services improve if you increase these deductions to 2.75%?
I don't know why you are insisting on talking about the increase.
Because, engineer, simple math, and I know you're better at mathematics
for the
than I
people,
am. So
for the people who are earning more than 100,000, from 1.7 is going to go to 2.7.
So take,
and therefore, it would be very nice of you when you say that we are increasing. You also say that it is reducing. It is reducing for the people earning below 35,000, and it is also reducing for the people in the informal sector from 500 to 300 bob.
Okay, this reduction that you're talking about from 500 to 300 bob, you're the one who's mentioned it now, because the NHIF Act proposal doesn't have it yet. We haven't seen the deleted version. The version that we have here has the 1,000 shillings. But let's do a quick math.
The president has pronounced himself on very many occasions on Labor Day. On Labor Day. We'll
be here and we'll figure that out.
On Labor Day, he pronounced himself. And anything that comes from the president is actually a policy statement.
Okay, but if somebody is earning 500,000, they used to pay 1,700, and now they're going to pay
13,500.
700.
Yes.
Isn't that an increment, engineer?
It is.
So
they have been carried by the people who are paying 5% all their lives. The people who are paying 5% have not been complaining.
Okay.
All this. Why should the 385,000 people, I told you, earning more than 300,000, compared to the 2.8 million who are probably paying more for them? Are we together?
Let's double back to my question. Will the services improve, engineer? Across board, leave alone even the people I'm talking about. Will the services improve?
The services are about to improve. That is why they are about.
So shouldn't they improve fast before you increase the deduction?
No, it doesn't follow. Because I told you that NHIF, we are at a turning point. Okay? We want to deliver quality service, and we want to improve NHIF. And that's a paradigm shift. There has been 2 attempts to introduce UHC, and both of them have failed. And there has been so much work done in the last, since the president came in. That's about 10 months ago, 10, 8, 9, fail on the count. So much work has been done to try and make sure that NHIF delivers on the mandate of UHC.
Okay. So we're talking about people who are asking that, first of all, you've mentioned that CEOs and 6 directors, you're going to advertise their jobs, right?
Tomorrow.
Tomorrow.
Yes, and I would encourage Kenyans to come and apply and do their national duty. Come and help us transform NHIF.
Are these roles part of the ones that were suspended?
No. NHIF, for about 3 years, has been working without 6 directors. I don't know why. We parted ways with our CEO in April of this year. We advertised for those positions, okay? We came to the tail end, and at that point, as a board, we made the decision that the people we ended up with would not help us deliver on our mandate to transform NHIF. Therefore, we are looking for Kenyans with skills in management for those 6 positions of directors and CEO to come and help us transform NHIF. Okay.
There's also a concern here, and I see a lot of feedback coming through, people saying that NHIF seems to favor civil servants.
It doesn't. Can I tell you? As part of the, employment, you have terms and conditions for employment. On top of paying that statutory deduction, and as part of their benefits, civil servants get an enhanced cover, and the government pays additional premiums for the civil servants. So it's not a favor. When you are employed, if you are in this job group, you are told that the government is going to pay an additional cover. These are the benefits. That is what attracts people into the civil service. It's just like companies here. I'm sure that you have structures, you have for, support staff, there is a structure for them. Yeah. There are benefits that will accrue for directors. They may not necessarily accrue for the people working in the lower cadres. Yeah. So you may find that for here at Citizen, some people have good private insurance, okay? Maybe part of the benefit to attract you as a person. Yeah. You may come even with a package that is personal to yourself. When you poach or somebody leaves Citizen, what will make somebody leave Citizen to go to Nation? Mm. I'm sure it is maybe for a better package. So as part of the benefits within the civil service, they get special packages apart from salaries. So, you know, if you come in as PS, you are entitled to this level of medical care, maybe up to 10 million. It's there in Parliament. It's there with the judiciary. It's there with the military. These are the benefits of some of the schemes.
Okay.
In the civil service, we have it. It is not that we give them preferential treatment. It's just that the government is paying more for them.
There's a question here sending in saying, engineer is saying that they are going to assess the level of ability for one to pay in the informal sector. What about those who pay for their parents, for instance? Will they assess the beneficiary or the payer?
One person, by the way, in fact, let's look at it, Trevor. You've brought a very important point. Out of the 4 million people who are now paying for the formal sector, and listen to this, out of the 4 million people who are paying, the moment we move from individual contributors to household, the number of households, the number of contributors is going to drop to 2.7. 2.7. That means we are going to drop 1.3 million contributors. What am I saying? If I am working and my wife is working, both of us contribute. Now, in this case, when we move into households, one of us, we can pick, my wife can decide to be the one who is going to pay, and I don't pay, okay? And that covers the households. Out of a population of about 50 million, we assume that there are about 12.5 million households, 4, the average family being 4. And out of that, only about 85% of those people are going to pay. Because even if you try, some people don't have IDs and they live in Kenya. So we assume if we have not gotten you to get an ID, it is also going to be very difficult to try and get you. So what you are saying is going to be an increase is even a reduction, because where we had double contributions, they reduced to 1.
Okay. There's a question here from Sheila Masinde who says, hold on, pay more to NHIF that churns out more graft scandals faster than it pays contributors' hospital bills. Government inatuchukulia mafala sana. With all these slush funds, can he outline measures taken to ring-fence the funds and ensure Kenyans' hospital bills are paid on time?
If they were owner of a hospital, probably I would answer it in a different way. But if there's that a contributor, I would really want them to tell me genuinely, in the community they live, whether they have not seen anybody benefit from NHIF.
Just last week, NHIF could not pay funds and people went to hospital and they were taken back.
But we paid. And those were funds that were premiums that had been withheld. The millions of people who are benefiting from NHIF, talk to the patients who are undergoing dialysis on a daily basis, 2 sessions per day. And let me tell you the other problem that we face. Unlike other insurances, where they go and tell you that now you have already been diagnosed with prostate cancer or breast cancer, they will not accept your cover. For us, no discrimination. Trevor, the people who come to NHIF, especially in the informal sector, is what we call adverse selection. Okay? And I'm not saying there is anything wrong, or I'm not trying to say that they are doing the wrong thing. But you find somebody who has stayed, is 40, 45 years, say a male, never contributed, never fallen sick. He goes to a hospital, he's told that he has prostate cancer. And that is when he starts to pay. He pays 1,500. In 2 months, the benefit of NHIF kick in. Complete surgery and treatment and chemotherapy after that. Somebody goes to a hospital, finds out that his kidneys are failing. He has been told that he needs dialysis. Pays 1,500, 1st of January and 1st of March. He is enjoying, not enjoying, sorry, that is the wrong word to use. He has access to 2 dialysis sessions at 9,600. That we can debate whether it should be 9,600, but that's what we pay out. We intend to reduce that. But generally, you find that the consumption of a dialysis patient is in the region of 20,000 1,000 per week. Multiply that by 52. It's 1 million bob without fail. So we don't ask for any pre-existing conditions. We do not want to know whether you have been diagnosed with any disease, and that is what NHIF is doing. Okay. That part of the problem that we are having is that we are bearing the burden of adverse selection. Why commercial insurances will go and tell you, oh, you have had breast cancer, okay, the likelihood of you, and then get to the age of 70, which you are going to get to, and they won't touch you. They tell you they cannot now insure you. You become a candidate for NHIF. So we have that problem, and that is why the president in his wisdom has decided NHIF as it is right now cannot carry the health burden of people. We go to social insurance, we all pay, the kitty becomes bigger, and we are able to support. And then what does the government do? Comes with what we are calling critical illness, FAD. Yeah. To FAD diseases like cancer, cardiac ailments, chronic diseases like, hypertension, diabetes, so that we grow in, and then we take care of now the other non-communicable diseases. Okay. I mean communicable diseases, sorry. How much of the accrued premiums were there, engineers, and from an insider's perspective, because Kenyans deserve an explanation? Just the other week, they couldn't get services if they had NHIF cards. Let me tell you, has it been settled? This is a fact. If I was in a parliamentary committee, I would answer it, and I'm going to Parliament tomorrow. Before we were paid the 12 billion that the government gave us, 12.5 billion, the government owed us 26 billion. Okay. So you subtract that, it's about 14 billion. So basically, it's a cash crunch from government that had put us into that situation. But it is not that we were holding money and received premiums. And what we do, we pool all our money. Money from the formal sector, money from the informal sector, premiums from government in one kitty, and then do the payout. Okay. What we are saying is, it's not lost to me that NHIF has serious problems in terms of fraud. We cannot wish them away. And I told you it is percolates from hospitals. I would name a hospital here, one of the big hospitals in Nairobi. Which one? No. We are on air. There is no point. These are facts, right? No. I didn't come here to point names. But I tell you, you are paying NHIF and you have private insurance, and they make double claims. Okay? So when I start here, I'm talking about hospitals. I'm talking about medical doctors, like the ones we saw, not only treating you, but causing harm. You saw the woman who was injected and is now bedridden. Outright fraud. Outright fraud. We have suspended 2 hospitals that claim to have performed knee surgeries on people. We make telephone calls, and then we find nothing. Of course, we have not paid the claims. Okay? Our own people inside us helping. So it's a clique. So when you hear the minister talking about dealing with the cartels, it's a lot of work. But most of it is going to be solved through IT systems. When we put an IT system that we are able to link with hospitals, and we have some hospitals. Let me, for example, give you a good hospital, okay? Metropolitan Hospital, where they have never been caught with a single case of fraud. Nobody from NHIF, and I can give it as a good example. If we all had hospitals like Metropolitan Hospital, then we'd all be very happy. Where they refuse, they will not overclaim, they may be punished, but they have never made a claim. Okay. So why don't I give you a good example? Why don't you also give me a bad example? Because now you've mentioned a name. No, so that people know they are good examples. So that people know it's not everything that is rotten. No, they are the hospitals that we go to. You will be there tomorrow. You can just mention it, because people need to know the hospitals to avoid them. No. Some of these are old cases, some of them as last year. Okay. And this is information that I have. All right. Let me bring up some of the feedback coming through, because there is a lot of questions coming up for you at Trevor Mbija at Citizen TV Kenya using the hashtag Monday Report. Let's bring up some of them and see if we can pose them to engineer here.
We see Nell, Chandiego, you can actually write them, then you can respond. There are these hospitals that one has chosen to go to with the NHIF card, but they claim that the card or the NHIF systems aren't working. What are you doing on this issue? In fact, you can just answer them as we go really quick.
Okay, that is capitation, where they are capitated. What they should do, *155#.
Okay.
Okay, put your question. Give us the name of the hospital. Okay, first of all, check whether you have paid, and that is the place where you told us that you are capitated. Capitation is the money we pay out, where you get treatment for outpatient. Or they can call on a toll-free line and ask those questions.
Okay.
Yeah.
All right, let's bring up another one here. Kolo Demakufu says, then how do you limit me on where to get treatment, yet I have contributed my own money? Let people get treated anywhere, depending on where they are when they get sick. You can't just let Kenyans enjoy what they pay for.
One of the problems, it's an IT problem. It's an IT problem. And it's, if we were like Turkey, where they have what we call portability, that means you can get your treatment in Mombasa and the IT systems allow. You are here today, the next day, let's talk about a driver who drives between Mombasa and Kisumu throughout. He's in 3 towns, but maybe his family is in Mombasa. That is where he has said that is his capitation center is. We give that money, about 1,300 every quarter, to that hospital for his treatment. So when he's in Kisumu or in Nairobi, he cannot get treatment. But that is only for outpatient treatment. When it is for inpatient or at a level 4 hospital, it can be attended. If we got a fully integrated IT system and all people are on smartphones, we could be able to deal with that problem.
Okay.
That is how Turkey does it.
All right.
Yeah.
Let's bring up another feedback and see what you're saying. Here, Sir Nixon Duichire says, Bwana Michael, kindly remove that condition of choosing 2 hospitals where one can utilize the NHIF card and make it open such that one can just use it anywhere unconditionally. Ugonjwa ijui region.
That is what we've just explained.
We've just answered right now.
Yeah. But that's only for outpatient.
Okay.
Yeah. Otherwise, admissions anywhere in hospitals that have a comprehensive cover.
Okay.
Thus.
Eric Nyakango says, what are the structures put in place at NHIF Kenya to ensure the end user gets value for money? How do they know the users get their services invoiced to NHIF Kenya? Do you make calls every time?
No, we don't.
Okay.
But
so
you actually get an SMS message. The moment you've gone for surgery, let's say it's a surgery, you get an SMS message that this is what the NHIF is going to charge you. And you recall those people in Meru. They got SMS messages. But I think maybe we need to do a lot more public education because they could have rejected. That mzee who was showing that his knee had not been operated, he could have rejected and said this did not happen. But he just kept it and did not, we give alerts.
Okay.
We give alerts. Even when you go and put your, biometrics, we actually said you an alert and a one-time OTP. But these are things that most people do not follow up on.
Okay. Chris John says, if an NHIF fund is a tax, I thought it's an insurance, so it cannot be used to bring financial equity. I mean, I don't understand it. Is there a malaria for someone earning 1 million a month and a different one for an unemployed person?
When we build roads, do we ask people whether they have cars? Let's use my example in the road sector. Suppose we say we won't build roads because the bulk of the people do not have cars. What would happen? What would happen? Okay. We won't build a port because I don't have a boat. Okay.
All right, let's see what else you're saying. Jeff Ogutu says, if NHIF could cover members comprehensively, there wouldn't be opposition to the 2.75%. You go to a government hospital, you are referred outside for lab. On admission, patients are buying usables like gloves, syringes, etc. No drugs in pharmacy. Hospitals are ill-equipped.
I will not deny that. The attempt is now to shift from that to what is talking about. Last year, January 2022, the NHIF Act was amended to the extent that we ceased to be national hospital and became national health, we are supposed to have prepared registration such that if you go to a government facility, there is a doctor who sees you, and there is no X-ray facility, you can go to a private facility and get your X-ray done. You come back to the doctor, he prescribes, and you go now to a chemist and take your drugs from that chemist, which is NHIF registered. That was the whole essence of health.
Yeah, but how far are you with that?
We have done nothing, I'm sorry to say.
Okay.
When we came in as a board, the last 1 year was lost. There was a court case and people got confused over what could be done and what could not be done. It's only this year that we got the proper interpretation of the law, that we could have proceeded with all those regulations that were not touching on what we are calling the employers, matching contributions. And therefore now we've begun to prepare the legal framework and regulations to onboard pharmacies, imaging centers, laboratories. Yeah. That means, and this may not happen, if you go to a government facility, they don't have a lab, you can go to a lab X, bring the results, the doctor prescribes, and you get your medicine from, so an integrated system.
Okay.
Yeah.
And how long will that take? Now that you...
The regulations, we are working on them maybe towards the end of this year.
Okay.
Yeah.
Let's see our last one here. Jaden says, do the new rates 300 affect the previous contributions already paid? For example, if someone paid for a year, because there are those people who paid with the old rates, what happens then?
That's a good one. I think I need to ask. Let me not just answer.
Okay.
Yeah.
All right.
I'm not quite sure whether if you had paid in arrears. Yes. Normally people pay, no.
Sometimes people pay in advance.
You pay in advance.
Block
somebody has paid like 6,000.
But at a certain rate.
I think I need to ask somebody
who
can answer that.
Okay. Engineers, we finish on this. Is there a time when Kenyans will just walk into a hospital and have all their bills covered by NHIF?
At my age, I'm hoping that I'll be able to walk, God willing, in 20 years when I'm not going to work, or in 30 years when I'm alone somewhere, not only walk to a hospital, but in my old age, have somebody coming to visit me, check on my BP, check on my sugar levels, and probably go to a pharmacy and bring me the drugs. That is the NHIF I would want to see.
Okay.
That's my dream.
All right. All right, so Engineer, this is a very interesting conversation, and I see a lot of people wondering, what is your plan to restore the glory of NHIF, and how long will it take you to clean it up?
My tenure is 3 years. I've done 6 months. I almost feel like I've done nothing.
Yeah.
You know, internally, there is so much that we've done. We've developed regulations, we've developed things that people don't see, you know, behind the scenes. We've been numerous meetings preparing for the launch of UHC. I can only say this: I've been given an opportunity to do something for my country. Okay. I'll give it all. All right. Engineer, thank you so much for making time this evening. Asante sana. Engineer Michael Kamau is the NHIF chairperson. You said you're going to the Senate tomorrow. That is the National Assembly. And remind Kenyans to apply for the jobs. There will be fairness. The best man will take the job. All right. The best man or woman. Yeah. Hopefully a woman. All right. Thank you for making time, Engineer. Let's take a quick break. We're back with much more in just a bit.